We're joined right now by Dr. Todd Ellerin. He's the Director of Infectious Diseases at South Shore Health. Doctor, it is great to see you. Today, the governor acknowledged that the uptick that we are seeing in positive cases, it is continuing. He even hinted that he might roll back reopening if the increases continue and if people don't take precautions seriously. So what do you believe the bar should be to ignite, to start a rollback? What do you think?
Hi, Ed. So it's an important question, maybe the most important right now. I think recently, if you've been following it, there's been about a 2% positivity rate. And then we've seen a big spike over the weekend. There were more than 600 cases a day as compared to, around 200 or more. So I think we have to intervene quickly. And I think if we see a doubling of that percentage, it was 2% to 4%. If it's anything around 5%, I really think we have to consider rolling back the reopening, going back to prior phases.
So once
no one wants to hear that, but
no, they don't. I'm sorry to interrupt you, Dr. Ellerin. So you're basically saying that rollback decision has to be made very quickly.
Maria, remember, we're already, once you start hearing about positive cases, you're at least a week, that happens, a week ago. And hospitalizations, you're a couple of weeks. Once you start hearing about more deaths, you're 4 to 6 weeks behind the virus.
I want to talk about particularly one case, and Red Sox pitcher Eddie Rodriguez. And here's how I want to frame it. There's a recent study by the Journal of the American Medical Association that said nearly 80% of people who had COVID-19, people who were otherwise healthy in their 40s or 50s, have signs of heart damage. Eddie Rodriguez isn't that old, but Eddie Rodriguez has a heart issue right now. So the question is, how serious is all of this?
So remember something, that paper, while important, looked at about 100 patients, so that's a small number. It did show that there were patients who recovered, a significant amount of them had some level of heart inflammation, okay? So what we have to remember is there's no question that COVID-19 is more than just something that hits the lungs. It does affect the blood vessels. But the key question is, what does that mean over the longer term? We don't know yet that if you get infected, you're going to definitely develop heart failure. It doesn't mean that 70 or 80% of patients develop heart failure. We have to see what the trajectory shows. We have to keep our eye on this closely and learn more about it.
Do we know why heart damage seems to be a side effect?
Well, I think it's important when we talk about COVID-19, we talk about the fact that there's a vasculitis involved. That means blood vessel inflammation. And as you know, the heart is fed by many blood vessels, right? So I think that is absolutely an organ that is affected by this, but to what extent, how severe, and is this long lasting? Those questions remain to be seen.
Before we let you go, I have to ask you about schools because we're in August. There's word of a COVID-19 outbreak at a camp in Oregon, at least 25 people infected, all under the age of 20. A similar outbreak in, I think it was the state of Georgia. All those outbreaks, how safely can we get kids back in the classroom next month?
Yeah, that's right, Ed. I think a lot of it depends on community transmission. If we're seeing significant amount of cases, if we're above 5%, 5 to 10% positivity rate, there's a good chance that we're going to see a lot of outbreaks in the communities. Now, these camps that you talked about, the one in Oregon, they were following their state's directives, hand hygiene, social distancing, keeping
masks,
kids to 10 or less, very static, not allowing them to interact with each other. Despite that, not only were campers infected, but the staff were infected. We could see the same things in schools.
Doc, thank you so much.
Thank you, Doctor. Be well.
Thanks, guys.